You know, very soon the United States Congress will be back in session, and the health care debate that raged before Christmas will continue. Many people think this debate is about over, but it's important to point out that there are still some very serious things wrong with the bill that they are considering passing. For example, it has federally funded abortions still in the bill. And so that means that if this bill passes, your federal tax dollars and mine will be used to pay for abortions. The other thing that this bill has in it is a mandate that every person in the United States has to buy health insurance. Whether they can afford it or not, they have to buy it. And in fact, there's a fine if you don't buy the insurance. That marks the first time in the history of our nation that the federal government has ever forced the people to buy something whether they want it or not. That alone has some very serious constitutional questions about whether or not the federal government can actually constitutionally force people to purchase something that maybe they don't want or can't afford. And yet that's in this bill. The third thing that it does is that it has an unfunded mandate to the states, where the states have to expand Medicaid, and in so doing they have to find money to do that. Who's going to pay for that? It's going to have to come straight out of the pockets of the people that live in that state. Unlike the federal government, we have to balance our budget here in Arkansas, which means that's going to cost us more money, probably in increased taxes. We're looking at huge tax increases to fund this massive program, not only at the state level for these unfunded mandates, but also at the federal level, because most experts believe that this federal health care program is going to end up costing trillions of dollars. Well, somebody has to pay for that, and we all know that it usually comes straight out of the pockets of hard-working Americans. And so I think it's important that we not lose sight or lose heart in this health care debate, and that we keep calling our representatives and our senators and urging them to pass something that's responsible, not something that's going to fund abortions, not something that's going to make people buy something they can't afford, and not something that's going to force the states to cough up millions and millions of dollars in unfunded mandates. And so there's plenty still wrong with this federal health care bill that we need to address, and I encourage you to contact your congressman and let them know what you think.